Super. Think we will have, I'll wait for the high sign from Olivia.
Hey, Timmy,
Yes.
before you get started, hey, it's Jonathan Fight.
Hey, how
Uh,
are you, Jonathan?
I'm great. I just had a quick question and can't wait to hear the meeting today. But yesterday's discussion with Bamboo, uh,
Yes.
I only caught the end of it. Is there a recording of that?
Yes, and it should be out. So I saw your email and I'll make sure that when it's recorded, I'll send it to you directly as well.
That'd be lovely. Thank you.
Yes, thank you. Thank you for joining, even for half. It was a great
Or it's
discussion.
just death by meetings these days. My God.
Well, here's another one. I can't wait to get us all
Oh,
kicked off.
I love the content. The problem is it's like going to a conference where you need to be in every room at the same time and you just wish you had clones of yourself. Uh, the physical logistics of being on all these fascinating discussions is an amazing. I mean, it's a luxurious problem to have, but
All right,
nevertheless.
Jonathan, well, we'll get started here right now. And I will make sure that, we populate this one for recording as well. I think we always do that. So, well, on that note, here's some great content today. Welcome everyone to Connecting for Better Health. For those of you who are new to us, if we want to go to the next slide. And the next slide. Our coalition, our vision is that every California and their care teams have the information they need to make good decisions on our care that's seamless, high quality, and affordable. And our policy priorities, I haven't gone through these in the last couple of meetings, but our policy priorities are always set every year. And this year, our priorities really haven't changed that much, although there's focus on continued education around the data exchange framework, being able to be really critical, especially in our funding and budget world that we're in, around how we are going to make best with the funding that's out there, and bring that to build infrastructure we need. And always not to lose sight of social services data, make sure that they have a seat at the table and are included in the design. And then we will talk today a little bit more about our work on advancing AB 1331 and helping to increase the enforcement governance, and helping each other stay accountable to the work that we're doing. So welcome to the coalition. If you are new, and if you have been with us from the start, we always ask you to share your name and organization in the chat. Some of the best work that happens that's outside of these meetings, we know that and we encourage it. So let's make sure that we are introducing each other and networking as much as possible outside of these meetings as well. If we can go back a slide, just the agenda today before I hand it off to my great team here. We have, as we were preparing for today is our day of strategic plans. Where are we and where are we going? And we have with us agency at state to be able to walk through the IT and data strategic plan. And then we also have our friends and partners at Civitas to walk through what's happening at the federal level. And then we will also spend time going through our California updates. We're in the budget season, and we also have in our tracking our legislation. I want to give you an update there as well. So with that, I'm going to hand it over to Stephanie to introduce Adam. Thank you, Stephanie.
Thanks, Timmy. Hi, everyone. So nice to see you all today. Looking forward to this conversation. Really excited to hand it over to Adam Dondro to get us started. Adam is the Agency Information Officer at Cal HHS and one of the primary authors of the Cal HHS IT and Data Strategic Plan. I think we highlighted this plan very briefly in one of our newsletters in a prior meeting when it was first released, but really excited to have Adam dig into it and share a little bit more about how we can all engage and see some of these goals through. So Adam, thanks so much for being here, and I'll turn it over to you.
Awesome. Thank you so much. I appreciate the opportunity, and appreciate you putting it out there for your folks when we did release it. I also want to introduce Deanne Wharton, our Deputy Chief Information Officer for HHS and my Deputy Director at OTSI. She's on and was one of the key architects of this plan, so she'll be helping as we walk through this. The plan, I will say, is available on our website, otsi.ca.gov, because we are going to fly through 60 pages in 10 minutes, hopefully leave a little time for question and answers. So I'll apologize in advance for flying through. If we can jump forward a slide or two to our introduction here. And all I'll say here on this is that we're really focused on a future about the people of California. And you'll notice that we don't mention IT or data once in this statement. And that was really on purpose. And that the point of this strategic plan isn't to define the technology. The point is to articulate how the technology supports our vision, our mission in HHS. So we'll jump on to the next slide. And I know that this slide is a lot. This was the attempt to fit 60 pages of strategy into one visual, and there's a whole lot here. And so again, I'll just say I highly encourage folks to take a look at the plan. Really what I like to highlight on this slide is over on the left side, and that our global statement about the plan here is that CalHHS envisions a healthy California for all that is enabled by the future digital ecosystem, and we'll touch on that in a couple of slides. To achieve this vision, CalHHS must shift towards a set of strategic objectives, and you see those in the orange box there. And these really, without trying to spend too much time articulating really the ties between the draft federal plan you'll be talking about next and ours, I think you'll really see that alignment and those strategic objectives there. And we've got person-centered, integration, equity, really a lot of commonality in the themes that we'll talk about in both of our plans there. And then those strategic objectives are catalyzed through implementation of foundations and approaches. And that's really where we start to dig into the what, the digital ecosystems, the why we're making this plan. The strategic objectives are kind of the big picture how, and then those foundations and approaches are the what that we really try to target there. Next slide. So I really try to articulate to folks that it's not just an IT and data strategy. And hopefully, when you look through it, you really feel that focus on collaboration, on partnership between program, data, and IT, because it's not a data and IT plan. Like when you look through it, it's really about what those help support in terms of implementation. I talk a lot of times to our CIOs about how IT is not just an order taker. And a lot of times CIOs really talk about that. Program tells me what they need, and I'll go and deliver that. And really, we want to shift that dynamic that yes, IT is there in the service of program, but more in the nature of a partnership, right? Program cannot effectively deliver and meet people where they are without IT being at the table and helping them understand the ways in which we can meet people there. And so it really needs to be a symbiotic relationship in the way that we go about doing that. But Deanne really brought this home for us in the nature of the culture. I don't know, Deanne, if there's anything you want to add there, and then maybe jump us into the FTE.
Yeah, sure. I think it's really interesting here that the plan both drives for this program data and information technology relationship, becoming almost a forcing function while also creating a need for that cultural change, right? And what we're really looking to do here is bring these groups together within their departments and across their departments, because it's only through that matrix, right, that we can connect these systems, connect these programs and services, and really drive towards that future digital ecosystem and really drive towards achieving those objectives that were laid out. So it's a big lift, right? For us, we've historically operated somewhat in stovepipes at our department level. And what we're asking through this plan is that everybody come together in support of something that will resonate with you, right? Which is increased access, affordability, and quality of services with just this unwavering commitment to equity. And again, that's not about technology, but we have to use technology and data to support those programmatic goals.
Next slide. Thank you, Deanne. This is the visual for our future digital ecosystem, and it's really about the articulation of kind of the life cycle of providing services in a variety of settings to the public that we serve. And this slide was really where I really felt like we got to the right spot with this plan, because when we shared it with our program partners, they said, it's a little bit technical, but I like the articulation. And when we shared it with our technology folks, they said, it's really not technology at all. It's way too program focused. And so we felt like we hit the right mark there in living between both of those two worlds. And really what we wanted to get to here is talk about capabilities. We're not talking about systems. We're not talking about the backup solutions that go behind them, but we're talking about capabilities that need to be provided, and that together those capabilities create this integrated, coordinated ecosystem to enable us to support individuals. And so that's the big picture there. And then on the next slide, we really get into the how, and Deanne is literally living and breathing this right now in terms of prioritizing where do we start. So maybe I'll let you talk a little bit there, Deanne.
Yeah, absolutely. I would add one thing to the prior slide, though, is that at the end of the day, what we're hoping is that this data that we're collecting through this continuous process, right? Continuously becoming smarter about the folks that we're serving, what they need. We're hoping will inform policy changes that again might lead to some of those objectives. So got to bring that policy piece in there as well. But in terms of the different types of things that we're focused on in executing on this plan is really to, again, start the conversations with all our departments around some of their longer term goals, programmatic needs, the capabilities that they're going to need us to support, and bring others in to have the discussions about what's that additional agency lift that we could get if we were to work across our departments and connect our systems and our data. What data do we need? What do we have? And then how do we not recreate all of these things, right? Getting back to the technology itself, how do we leverage what we have? How do we work across these departments on these specific capabilities that you saw in the FDE piece around eligibility, enrollment, screening, consent, some new things for us, right? Both in terms of the transactional technologies as well as some of the underlying pieces. So we are putting together our plans on how we tackle those things, what makes sense first, second, and third, while also bringing our departments in to help, again, talk about this shift towards this coordinated approach to planning.
And a big part of it for us was that culture change is moving upstream, and that a lot of times program decides what they want to do, and then they articulate that to IT, who goes to figure it out. And we want to bring everyone upstream to have those conversations about what's possible, so that when programs thinking about the service they want to provide, the data folks are at the table saying, here's what we need to bring together to inform that, and not having to do that afterwards. And with IT, architecting systems that can facilitate that instead of trying to kind of cram a round peg into a square hole, to use the analogy. Next slide, which is certainly our most technical. And this is where we really try to articulate those data capabilities and integration capabilities that we just talked about. And this is how we try to prevent silos, is to, at an agency-wide level and with partners outside the agency, look at these capabilities about how do we match people up? How do we know that the Adam Dondro getting these services is the one putting in this application, right? Who's related here, so that we can, with consent, start to tie those together and have that whole person vision, right? Those are the things that one individual program or one system have no incentive or reason to solve for, because that's not what they're designed for. So we're trying to lift that up at the agency level, where we create those incentives through governance, through oversight, through partnership, on why those solutions need to be built either at an agency level and shared, or standardized across those systems. And that's where, if we don't do these things, you can't get to that whole person care. You can't get to that visibility without moving upstream and kind of working in these capabilities. Next slide. So this is just talking about those foundations. And again, this is what Deanne was talking about, that we're focusing on, and bringing in that strategic asset management, where it's not program by program, but it's looking across the whole portfolio and the things that we need to do there, allows us to optimize our resource usage, allows us to treat data intentionally and not as an afterthought. That's just an output of these systems, but it's intentionally designed into how we need to collect it, how it needs to be available, shared, used, all of those things. Deanne, I'll pass to you if you want to add anything. And then Deanne is very passionate about workforce development and often guides us there.
Yeah, I am very passionate about that. And you know, I look around and I'm looking for a future where, again, we drive the really terrific jobs, thought work associated with this into the state work. But one thing I wanted to say about this is that all of these things that you're seeing on this slide and everything before rely on this really focused partnership, as Adam said a couple of times, with our statewide partners, right? We can't do any of these things in terms of the asset management or resource usage, data and workforce development, even unless we have those close relationships with the counties and with our other partners. And so that underlies all of this as well.
Deanne. Next slide, and just to wrap it up, just to articulate, the plan articulates that we will be building action plans out of it. And so it operates at the 10,000 foot level. And now we're developing action plans on what those next steps will be, which will include who's responsible, who are the partners, who are the interested parties to include, and what are the metrics by which we'll be able to measure that we're actually moving the needle on these things. And then just last slide just speaks to that point that we don't measure the success of this plan by how many systems we build or their interconnectedness, but by the improvements we see in the ability to provide services and whole person care to individuals. So with that, I know it was fast. We did want to leave some time for questions. I know I saw one question about sharing data across, and we are looking at things like universal release of information. We're looking at consent management and how we can play in that space, and making sure that systems are built to be able to facilitate that. So we don't have those answers yet, but that is exactly the kind of space that we think that we need to be playing.
Yeah. I saw the other question too around data governance and directives to align and streamline information that's captured. Absolutely. One of the foundations speaks specifically to that data strategy, to the data sharing, that governance and standards. So definitely something that's included within the plan. And I see the note on the documentation burden, right? The repetition that goes back to the optimized resource usage across data, technology, and program. And
Thanks,
yes, data
Adam and
quality is a
Deanne.
big piece of that too.
Yeah, I was just gonna raise that question up to both of you.
Yeah, there's a specific, again, foundation that talks to once we know the data that we need in order to affect this plan, then there's a whole baselining of what we have, what the integrity of the data is, right? Which goes beyond the quality, but includes that quality as well. And it'll be a challenge.
So I think there's also, I don't know if this has come out explicitly, but can you also describe the intersection with the data exchange framework and the data sharing agreement? And we've been spending most of our time here together over the last 3 years evolving that work. Can you give us some thoughts there?
Yeah, absolutely. And so, I mean, John Ohanian and CDI are co-authors of this data and IT strategic plan. And so we're driving that forward together. The data sharing agreement piece, right, existed before their office even existed. And it was certainly a core part of us thinking about the way that this plan is articulated in the way that it was built, right, in collaboration and partnership between data and IT and program and setting those frameworks. And then the data exchange framework, it's interesting. It's something that we view it as a part of that whole person care and trying to start recognizing that government doesn't operate in a silo. It's not just about the 12 departments and 5 offices under the CalHHS umbrella. Is then working with providers, insurers, community health workers, nonprofits, CBOs, right? All the folks who then actually utilize this to provide the services. And so it's a key part of the way we think about this, and will no doubt be one of the action plans that we work with John on under this IT and data strategic plan to articulate what those particular goals are and how they tie back.
Yeah. Really excited about that because of the access to outcomes data the information that we haven't historically had, so we can start to understand what programs work in what combination to drive towards that holistic care.
And then I'll just tag onto that too. We've spent quite a bit of time on consent and acknowledging, and I keep coming back to this idea that consent is really the linchpin in helping us to really meet the needs of our data sharing goals and objectives. And we were very, very focused on the Ask Me pilots last year through DHCS, and
Yep.
want to see that evolve and want to see how we kind of create a universal consent and almost, a standard way to be able to access consent across the board. Is that something that we should be looking to you all to be part of that conversation? I think right now it's been really focused with DHCS. You can give us guidance there.
Absolutely. Yeah. I mean, they're the early adopters and we're working closely with them to watch and learn. But yes, we absolutely want to be a part of that. And we view it as, like you said, one of the critical components of identity and access management, right? And how we enable those linkages. And so it is going to be a core part of this plan and the ability to achieve those goals that the Secretary and Governor have laid out for us. And so we expect to be engaging in that heavily.
We have a question around CDSS. Are they connected to this effort?
Absolutely. I mean, they're a key part of it. And I mean, obviously with the tie with data exchange framework, their key component is as we look towards this next year and advancements with data exchange framework, social services data is going to be the focus. And so they are right there as on our side, working through what are the key things that we need to start with when we focus on this.
And then just maybe, Stephanie, one more question too, is the action plans. When would we, and how do we as a coalition stay close to that? Where and how are they being formulated? When should we be seeing them be put into practice?
You want to take that, Deanne?
I think it's a great question. Right now we're in the process of prioritizing. We have some activities that are already underway, but Adam, we should talk about how we can provide insight or access to that and thoughts. I'll give you a heads up though. The action plans are really 1 to 2 page documents and then assigned to teams to further blow out the planning or the work to be done. So the action plans themselves talk about the objectives, the activities, the alignment with our equity measures. But at the end of the day, we'll have, it can't be Adam and I doing all of this. We'll have folks across our agency, other departments, data groups, et cetera, kind of leading these plans. But it's a good consideration. We need to figure out how we make sure we've got some transparency there.
Yeah, we'll think about that. They will, as we develop them, they'll be posted alongside with the strategic plan on our website. So at a bare minimum, like we'll be ensuring that, but we will need to work out kind of communications and bringing in interested parties that want to participate as we lay out those priorities.
I think you have some very interested parties on the line here. So count us in, a thumbs up.
Adam, did you see Felix's message in the chat about the digital identity strategy? I just want to make sure there's no confusion on that one.
Oh yeah, please address it.
Yeah, so produced by CDAI. So I mean that's for them. So OTSI doesn't implement that for them, but as we talked about, John and I and our 2 offices are kind of 2 sides of a coin, right? We work closely together. We can't go anywhere without the other with us as you look at data and IT and how they work. But that's not our particular strategy. That's them laying out the CDII approach and how they're going to be structuring their office in those pieces. But we do work in close partnership and supporting each other.
So hopefully it becomes a driver or at least an input into your work.
Absolutely.
Okay. Stephanie, should we wrap?
Yeah. Thank you so much, Adam and Deanne. I really appreciate your time. I know you both rearranged your schedules to join us today. So glad to have you on and would love to continue the dialogue and welcome you back to Connecting for Better Health anytime.
Thank you. Give the opportunity.
Thanks so much. Okay, we can move ahead. Moving on to our federal plans, really excited to have Alan Katz and Jolie Rizzo, both of Civitas Networks for Health, who are on today as well. And Alan and Jolie are going to talk about the Federal Health IT Strategic Plan draft and the CDC Public Health Data Modernization Strategy. So Alan and Jolie, I'll hand it over to you and we can drive your slides. So just let us know when to advance.
That sounds great. And I'll just say hi, everyone. Alan's going to primarily be our presenter, but I'm here to play backup and just really appreciate the opportunity to be here with all of you.
Thanks, Jolie.
Well, thank you. Thanks, Jolie, and thank you, Stephanie. So we'll get started. We don't want to take up too much time. For those of you who may not be familiar, Civitas is the National Association of Nonprofit organizations around the country that use, manage, operate infrastructure related to health data. Our members include state-designated health information exchanges, regional health improvement collaboratives, quality improvement organizations, all-payer claims databases, and other related nonprofit and public interest entities around the country, including a number of C4BH, of course, is a member, and others. So just as an FYI, we have a pretty wide footprint and, of course, a compelling interest in these strategic documents. So we can go to the next slide here to get started. That is our title slide. So here we have kind of just the summary page for the Federal Health IT Strategic Plan 2024 to 2030. This is the second 5-year plan that's been put out by ONC on behalf of HHS following the previous version, which was 2020 to 2025. And as you can see, we have 4 primary goals here: promote health and wellness, enhance the delivery and experience of care, accelerate research and innovation, and connect the health system with health data. And each of those goals are associated with 16 different, we have in total 16 different objectives here under each of these goals. And in addition to the 4 major goals here, there are also 6 federal health IT principles. Those are person-centered, inclusive design, safety and quality, privacy and security, data-led and data-driven decision-making, increasing health equity, and encouraging innovation and competition. And so those are additional sort of broad form principles that are applied to this framework from HHS and ONC. And all of these, the 4 goals and the 6 principles align, broadly speaking, with Civitas's own mission and principles and the mission and core objectives of our members. And if you're thinking, well, these sound very broad and not particularly specific, that would be correct. Most of this this strategic plan is in the form is not so different from this summary page here. It's in a very graphical form. It's like an extended slide deck and graphical presentation rather than in sort of a white paper or narrative form. So there isn't necessarily that much detail as might be found in some other policy documents or strategic plans. It's really the goal is to ease of dissemination and public consumption. So unsurprisingly, I think ONC has found that this format, open visual format, is better. And so we can move ahead to the next slide. We can get into some of Civitas's comments. Public comments are open through next Tuesday. We have draft comments put together. And the main thrust of our comments is the idea that all of these principles are important and the work being done is important, but as the association that's representing non-federal operators, users, organizations in the health data space on the state level, on the local level, regional level, it's imperative that ONC actually acknowledge this non-federal work and partnership that's been critical for driving so much of the innovation and the progress in health data sharing, and especially scaling up successful models, pilots, demonstration programs that really were seeded or begun on the state level, local level, and taking that for the proven work and taking it to the federal level. It's really at least as much of a ground up enterprise as it is a sort of a top down enterprise. And it's important that the federal health IT strategic plan acknowledge that. So that's the main theme of our comments. And if we go to the next slide, we'll can just show some examples of where and what we're filling in here, what we're recommending. So you can see this is the format of most of the strategic plan. Each of those 16 objectives that you saw on the initial framework slide is further broken down into these kind of different blocks of these little flow down charted categories here. And so just running through them quickly, the federal government plans to, so here, build on the collection of evidence needed to improve the use of EHI so that, and then there's a somewhat more, not even really detailed, but just sort of follow on an elaboration on that. Data classes and data elements that improve clinical and social determinants are standardized and included in health and human services systems. So certainly this is, aligns very well with the work of Civitas and the work of our members, and is kind of a macro level theme across the health data sector. But if we're looking at this strategic plan and what we could add, we really want to put in, for example, that we want to build on the collection of evidence that has been pioneered by non-federal entities, by state agencies, by state designated HIEs or collaborations of HIEs and other entities, by emerging health data utilities. And so those are the kind of relatively minor but important edits that we're making throughout this document. And again, there isn't a lot of substantive detail here, so we don't go into long discourses into the details of specific programs. That's really not the point or the format for this document. But the point is really to sort of fly the flag for non-federal entities and really make sure that they're reflected in this work. So the next one here, just running through quickly, improve the use of public health data to address community health challenges. Again, well, if we're going to talk about addressing community health challenges, we want to acknowledge the community organizations that are on the front lines of addressing those community health challenges. Advanced standardization and interoperability of social determinants of health data. So again, it would be relevant to talk about, for example, SDOH data elements that have been pioneered in Medicaid Section 1115 waivers in a number of different states that are partnerships of state health departments alongside collaboratives of HIEs, RICs, community-based organizations, etc. Implement health IT education and training programs. This is obviously critically important for any organization in the health data space, but the fact of the matter is that health IT education and training programs are overwhelmingly overseen by state accreditation bodies, whether in higher education or in many cases like a state health department or both. And of course, to make these programs effective, they should be run in collaboration with the employers in the private and nonprofit sector, as they really already are. So that should be reflected in the strategic plan here. And of course, those programs should be adequately resourced as well, or because the plan doesn't really address future appropriations, using existing resources and authorities that HHS departments have to support non-federal entities collaborating with federal programs that support education and training. Streamline the secure access, exchange, and use of linked health and human services data sets. Again, this is another opportunity to plug our non-federal members and the emerging health data utility model in particular, which, if you're not familiar, is kind of the next phase of statewide health information exchange that integrates SDOH, public health authority, research, community-based organizations, and other sort of comprehensive and value-based use cases into data exchange and within a multi-stakeholder collaborative governance framework. So Civitas is trying to disseminate raise awareness of the HDU model as it's being increasingly implemented on the state level by a number of our members. And that's something we would like to see reflected here as well. Next slide, we can wrap up this section of it here. Again, here, just more examples of.
Adam or Alan, sorry.
Do we have,
Well, there's a few
questions in the
questions
chat
on the
here?
last slide, and I also just want to make sure that we get through all of your content. But there's some real discussion around the first tenet around the SOGI data and making sure that we are really focused on all the work that's going on right now with the standard setting agencies. So Stephen was asking, is Civitas working to assure that members are adopting USCDI standards? And
Oh, absolutely. Yeah, that's a big
is that
yeah.
also going to be incorporated in your responses?
You know, it's a very good comment, a good point. We actually, our comments don't even go into that level of detail because the format
not
of the
getting there. Okay.
document, yeah, the format of the document doesn't go into the level of detail. We do acknowledge in kind of the intro to our comments that our members, like non-federal organizations around the country, are generally, if anything, ahead of the federal baselines for USCDI. So Civitas members were pioneers in introducing and piloting data elements for version 2, version 3, and now version 3 is kind of the baseline for us, even though they're federally, they're just as a result of rulemaking over the past year, moving up from version 1 to version 3. So essentially, we're ahead of the curve. We've already contributed SDOH coding and data elements to USCDI, and we would certainly want that that to be acknowledged. Although again, it's not really the format of this document doesn't really lend itself to like going into specific metrics.
Okay, great, thank you.
And Alan, I would also just note, Stephen was asking as well about just kind of our involvement with ONC, the Sequoia project, and others working on metrics and methods to advance data quality and usability. So, you know, we are, we do work closely with the Sequoia project and are familiar with their data usability work, and, you know, also are in really close contact with ONC. We have further to go with sort of making these connections, but certainly it is something that we are connected on. And again, there's just sort of additional opportunities for us to further reinforce, kind of like what Alan was just saying, where HIEs and health data utilities really are and can continue to sort of support and assist in making sure that data is useful.
I don't know, and now I don't know if I name checked it specifically, but the Gravity Project is an initiative within Civitas that has been contributing a lot to.
Just to bring some clarity to that, Alan. So in last year, we had funding from Robert Wood Johnson Foundation to support implementation of SDOH data standards through Gravity Project. We are now members of the Gravity Project and continuing to support the implementation affinity work group, and are working very closely with a subset of Civitas members in New York that have all sort of decided per the 1115 waiver to move forward with adoption of the Gravity SDOH standards. So really closely involved, but I want to be careful to not make it sound like Gravity Project is an initiative of Civitas.
Sounds good. And I just want to do a time check. I know you have more to get through here, so.
Oh yeah, we can move to CDC. I think everyone
Okay, thanks,
gets the
Alan.
general gist of.
Yeah, I just want to make sure we get to the call to action.
Oh yeah, of course. So at the essentially, you know, at the same time that ONC is releasing the federal health IT strategy, CDC specifically is addressing its 2024-2025 public health data strategy. Again, this is over the next, well, now I guess it's a year and a half, so shorter time frame than the 5-year ONC plan. This comes from the Office of Public Health Data Surveillance and Technology, OPDST, which is relatively new within CDC, but is certainly the lead on all of their health IT, health data, and data stream integration initiatives. And again, much like the other strategy, CDC's public health data strategy for the next through 2025, structured around, they're really a set of 4 annual milestones, which are aligned with the 4 public health goals of OPDST generally. Strengthen the core of public health data, accelerate access to analytic and automated solutions to support public health investigations, advance health equity, visualize and share insights to inform public health action, advance more open and interoperable public health data. And all of these themes relate to other top-level CDC programs and initiatives that are of interest to Civitas, to our members, C4BH, and other non-federal entities around the country, including pandemic preparedness and the CDC's data modernization initiative and the TMI-related public health data modernization grant programs. So we can go to the next slide here. And so the next couple slides are just, again, examples of the different milestones within the public health data strategy that Civitas is most interested in. The strategy itself is focused on these 2024 and 2025 milestones. So it's really broken down. So you have each of the years. Each year is broken down into 4 different categories that are aligned with those sort of top level themes. And then you've got 2024 milestones, 2025 milestones, and short explanations of why it matters. Again, this is not like a long narrative format strategy document. It's very visual for ease of dissemination. So this is particularly interesting here. This speaks to CDC's priority to increase coverage of and efficiency for the connection between emergency departments and CDC itself. And of course, many Civitas members are core intermediaries between those EDs and CDC as part of syndromic surveillance and the NSSP program, which is why this is up here. And in particular, you can see in 2024, 82%, the goal is 82% of non-federal EDs send data to CDC. Coverage increased to greater than 30% for low coverage health service areas, low coverage health service areas being a designation for within the NSSP program. And then they want to boost that up to 84% by the end of 2025, which speaks to how relatively difficult it can be to really connect to some of these more rural, underserved, and difficult hospitals to reach, and the critical role that Civitas members and other non-federal entities as intermediaries within state and regional networks really play in allowing this to happen, especially through connectivity with statewide as well as county level public health departments, et cetera.
So Alan, so I'm lost on the Civitas. So this is what their milestones are, and
Correct.
what is your response to them?
So there's no like I'm just highlighting. It's not a comment really. We're just highlighting some of the milestones that we feel are particularly interesting.
Are they also asking for comments back or no?
No, they are not. So which is why we don't have like a formal.
But safe to say, Alan, we are in conversation with CDC. We met with the Washington CDC office when we were in DC not that long ago. We have a follow-on meeting coming up June 12th, and want to continue to really encourage what Alan was saying earlier, which is for them to acknowledge the existing infrastructure that can support some of these aims and to not overlook that. And so that's really, a big part of what we are doing and calling attention to health data utilities. And again, the sort of HIE infrastructure that does exist across the country in supporting their needs for increased data.
And are we, I just want to make sure that that call to action for the group that's here, as well as our colleagues, if there are pieces and parts that we think should be and can be kind of pulled through your voice, can we collect those and be the conduit to you?
Oh, absolutely.
Okay.
Yeah, we really welcome.
I want to make sure everybody hears that.
Yes, it's tremendously helpful. So as we're working on comments or we're going into these meetings, the more sort of information we have for those that are truly sort of in implementation, working on this day to day, that, you know, are in states throughout the country, that really does help us. So yes, absolutely.
Fantastic. Stephanie, I just want to do a time check. I know you have some more information we
Yeah,
want.
we're just about time, Alan and Jolie. If there's final CDC pieces you want to wrap up, that would be
Yeah, you
great.
could just quickly run through the rest of the slides here. So next slide, similar thing, but ELC, which is the CDC's primary laboratory program. So lab connectivity, the same way that the previous slide was emergency department connectivity. It's the same theme, and our members are integral to increasing that. Laboratory connectivity has been a big issue within Civitas among the sort of HIE and emerging HDU communities, et cetera. Next slide. The next two slides actually are
Well, and
focused-
Alan, I might just say, since they really are at time, they're going to get
Oh,
these
okay.
slides. If you have additional questions, please just reach out to us. Alan can, you know, have follow-up conversation is something that we're focusing on. So just, I want to be mindful because I think, you know, you guys do need to move on to other things. And I actually have to drop as well because we're hosting a big national virtual event that's going to kick off in 12 minutes that I have to do. So, but great to be with you all.
It's so great to be able to have you as partners, and you know, this is a great orientation and zooming us into what we should be reviewing. So and just remind us, the ONC comments are due when?
They're due on Tuesday. So, you know, we'll put forward a set of comments that anytime Civitas is commenting, we're commenting, you know, on behalf of sort of the best interest of our members. And so, you know, but if you have additional thoughts about things that Alan shared today that you want us to work into our comments, we are very happy to do that. Obviously, we're working under a tight timeline,
Yes.
but certainly are open to that.
Great, great. Thank you. And so let's wrap with this. Again, thank you, Alan. Thank you, Jolie.
Yeah.
And we will see you again soon. And thank you for having us in DC too. That was a great day. So Stephanie, do you want to walk us through the state updates?
Sure. Yeah, thanks so much, Alan and Jolie. If we go to the next slide, we just have a really brief summary of the May revise. Governor's May revise came out about 2 weeks ago on the 10th. Lots of cuts and reductions, a non-exhaustive list, but just on the next couple slides, we highlighted a few for you all. First, the revise proposes quite a large cut to the equity and practice transformation grants. We spoke about these grants earlier this year and last year as well, on grants coming from DHCS to Medi-Cal providers to support delivery system transformation. This program specifically, you know, called out technology and data activities in this grant program, including DXF implementation. And I know I saw that we had CMA on the call today. I do know that they submitted a letter opposing this proposed cut, as I know some others have as well. In addition, the revise has just a few more programs we'll highlight quickly with large cuts, proposals to public health that would impact both local health departments and CDPH. There's also a lot of proposed cuts to various healthcare workforce programs, community health worker training programs, nursing programs, and some Song Brown training programs and scholarships as well. If we go to the next slide, just a few others. The revise proposes eliminating $72 million this year and $348 next year on the Children and Youth Behavioral Health Initiative under CalHHS. And there's also about $2 billion in both cuts and some delays to broadband funding through a number of California programs related to broadband. So just a reminder, the legislature is, you know, discussing, dialoguing, debating all of these proposals right now, working on their budget act that they have to pass by June 15th and then send to the governor. And then negotiations on trailer bill language can continue into July. But at our next few meetings, we'll make sure that we have a budget section each time to continue updating you all on this progress. I don't know that we really have time for discussion. I know that the May revise was not uplifting or positive news for a lot of organizations, but looking, to see what negotiations and different proposals might come from the legislature in the next few weeks.
I feel like that if you all are fans of NPR in the marketplace, is the down music is being played as Stephanie just went through those. So it's real when it's in black and white. And I see the note from Felix around the cuts to the modernization for public health. Yes, we'd love to be able to talk about that. Stephanie, we can follow up with Felix and the equity grant as well. Connecting for Better Health was able to support the letter for CMA. Thank you, David. I didn't see you still on. Let's get through the legislation.
Yeah, let's go to the next slide. Just a quick key dates for the rest of the summer through September 30th. And I think we can just go to the next slide. And Olivia, I'll hand it over to you to talk through some bills. Jonathan, we do see your hand. We're going to get through bills and then we'll have some questions, time permitting. So go ahead, Olivia.
Everyone. All right. There's been a lot of movement over the last few weeks in regards to bills. We will note that the bills that are marked in blue are not moving forward at this time. Tomorrow, which was on the previous slide, tomorrow is the deadline for bills to move out of their originating house. And it is likely that the bills marked in blue will not be doing that by tomorrow. We will note that the 2-year bills that we've been tracking, AB 1011 and AB 1331, we expect that there could be movement on these in August following the summer recess. Once Senate Appropriations hears other bills from 2024 is when the 2023 2-year bills might begin to move. And let's go to the next slide. All of these bills on this slide have actually passed from their original house and have moved to the next chamber. I will note that there were some significant amendments for SB 1016, which instead of requiring this OMB or this more detailed demographic data collection for Hispanic, Latino groups, and also Mesoamerican indigenous nation groups, instead of this requirement just being for CalFresh, they removed that language. So now this is a requirement for CDPH in total by 2027. And moving on to our final slide, tracking all of our AI bills. Again, lots of movement here. Most of these bills have passed or are about to pass. So we expect that they will continue after the summer break. And as a whole, there were not too many significant amendments here. There is one worth noting for, I believe it is 3030. Oh, no, sorry. It is AB 2930. So this bill requires, has certain requirements for developers of automated decision tools and also people that deploy them or organizations that deploy them. And they amended this bill to also have these requirements extend to state agencies that use automated decision tools. And I think those are the main bill updates. We definitely encourage people to go back and reference our tracking slides in the PowerPoint where you can read more into the details, but we are continuing to stay on top of all these bills that are moving, and we will report back in 2 weeks.
Olivia, can I just pop in on AB 1331 quickly?
Yes, please.
I just want to reiterate the call that we made a couple weeks ago around stories. We heard pretty loud and clear from CalHHS and other policymakers in Sacramento that they're looking for additional data exchange framework stories. So, we have some on our website. We're launching more from our day at the Capitol. But if you or your organization would be interested in sort of spotlighting how data exchange improves, your service delivery to Californians, the impact on your workforce, any component of that, please reach out. We really want to work with you all on that. And the other piece that I'll mention just really quickly is that, as Olivia mentioned, AB 1331 is in Senate Appropriations. We'll be looking to schedule some in-district meetings towards the end of July with the Appropriations Committee members, and maybe reaching out to some of you that live and work in those districts. So please be on the lookout for that. We're, motivated and engaged to continue our 1331 advocacy after our day at the Capitol, and it's going to be a busy summer.
Thank you, Stephanie. So keep your inbox open for those requests, because we'll be having to do a lot of the work outside of these meetings.
And we do have 2 quick announcements if we could get to those before taking Jonathan's question. We would just like to note that our July 11th meeting, we are going to cancel for summer break to give everyone some time back on their calendars. So I hope everyone enjoys that and is doing something fun. And our other announcement is that we did release some clarifications to questions that were received at our last meeting around our new fact sheet. So the fact sheet has been updated with those clarifications, and a separate Q&A document is available that you can access in the slides. And those are the big pieces to get to, Timmy. So I'll give it back to you now.
And Olivia, I think on the cancellation, do we think that we've got the glitches worked out?
I am gonna
Again,
we are reaching out to Zoom. We will be canceling that meeting as an occurrence, but I am not sure if that's going to roll over to people's calendars. So I'm going to work with Zoom to try to take that meeting off of people's calendars, just so there is no confusion that we are not meeting on July 11th. And perhaps we'll
doing
also
our
send
best,
an email
folks.
that day.
Yeah, we're doing our best with these recurring meetings and making sure we're not gumming up your calendar. So, just work with us. And if you have a question, just reach out to us. We're always here. And Jonathan, a question.
Hi. Yeah, so actually it's just I guess a combination of comment / tack onto your stories bit. And I also just put a link in the chat here that might be helpful for folks. So first of all, as of now, we've got about 12 fire EMS and community paramedicine services that are fully through the process, attested and everything to connect to the DXF. So I just kind of want to volunteer on behalf of several of those agencies. We'll be very happy to provide pretty emotional stories. Some of these are rural, some of them are dealing with substance use issues in their community, roadway deaths, really strong stuff. And several of them are in Assembly Member Wood's jurisdiction.
That's right. Thank you. Yes.
So yeah, if we could, again, we're happy to connect you with the folks there. They're happy to talk about it and shine some light on some folks that don't get a lot of attention, namely the whole fire and EMS ecosystem. So happy to sort of volunteer that dialogue. The second bit, I think this point that's what on the website or on the slide here is an interesting one that keeps coming up in our world too. And this fact sheet that just came out in February is about the final rule that align or more closely aligns 42 CFR Part 2 and HIPAA. And this has been a very big, very misunderstood, very under-heralded barrier to sharing is the mental health and substance use rules under SAMHSA, not HIPAA. The sheer number of people who have to be educated on this other administration and its own rules is kind of remarkable. I have pretty strong feelings about it that I'll leave aside right now. But the fact that people just don't know it exists, like it's a federal administration, it's not a small group.
Yeah, no, and we did have I just want to, again, look at the time, but Jonathan, we did have Devin McGraw was able to come and walk us through the changes there. So I want to point folks to that webinar too.
I think that this fact sheet's really simple, and to the degree that folks can save the chat or you want to grab the URL, I think it'd be worth putting out there. It just came up at a meeting of state administrators of emergency services just last week. The feds were there. They're still talking about HIPAA as a barrier. And the idea that there are these rules and there are changes that people are not hearing about, the more they hear that this is a thing, hopefully the more that makes it easier for folks to realize this is a foregone conclusion. So
absolutely agree. And it is, we're moving in the right direction, and we will include it in our newsletter as well and make sure that we bring up that fact sheet. That's terrific. Yes, Nancy, there is a recording on all of our consent sessions. And I put them in the chat earlier. We can probably find it again and put it in the chat again. But we had last year, we published our consent paper that I think is really comprehensive. Of course, that was before the changes for CFR Part 42. And then we also had 4 webinars that really went in depth in each of the different chapters of that paper. So for folks that really want to get up to speed there, I really recommend spending some time there. Jonathan, thank you. We will follow up with you with your stories. Everybody who's still here, please bring us your stories. Thank you for coming today. It was a fabulous discussion, and I think we can wrap. Have a great day.
Thank you all.
Take care.